Good evening, everyone. And I would love to welcome you tonight to our fourth Patient and Family Conference. This education event is held by CancerCare Manitoba with the generous funding support of our CancerCare Manitoba Foundation. My name is Lorena Garrell, and I am a manager of the Hope and Healing Program at CancerCare. That includes information, education, and support for patients and families living with cancer. And I must say, I've felt very privileged to have worked in this area for the last 17 years. It's been an amazing opportunity to be part of helping people that are living with the cancer and also working for such an incredible organization. And now it is my pleasure to introduce Knowledge Keeper Mishomis Alan Sutherland. I am very honored to invite Alan Sutherland to join us and provide an opening blessing for the conference. And now Alan will introduce himself.
Thank you. Wapski menesizet mesetemnis nakaz, vizunidodem, ishkunaning donji, Treaty 2 Territory, Nishnawbe, Sotunin. I'm White Spotted Horse of the Lynx Clan. I'm from Skowhegan First Nation of Treaty 2 Territory. I currently live in Cooks Creek in Treaty 1. And I'm Mishumis Alan Sutherland, Mishumis' grandfather. I've been offered tobacco to do an opening prayer for your event. Before I even begin that prayer, I'll be mindful of all the things that are happening here, including the fact that I read that offered through our Hope and Healing program. And that reminds me of a teaching I had this the other day on the four hills of life. And life is not one linear road. There's a lot of hills to climb. As you go up, then you can see far away distance. It's clarity. But there'll be times when you go into dark places, and then you don't even know your next step. Now the road is full of side paths and distractions and turbulations and beautiful activities. Life is different for everyone. Now that teaching was about, in reference to your program, is Hope and Healing program. That I just described as a healing journey, which we're all on, from birth to childhood to adolescence to adulthood and elderhood. And along the ways, it's a lot of mishaps and opportunities and adventures. Now, the healing journey is that you'll be tested, the good, the bad, the ugly, and the blessings. And may we always have more blessings than the ugly. But it's so different for everyone. The hope is to know that nothing stays the same. There's always the ability to move forward. And our ancestors, our elders always say, you know, when the difficult times, it's always best to keep moving forward. Then one day you're in the open. The fog is not there anymore. That's the hope piece. But the opportunities is always with the steps you take, the action that you take, to do everything you can to move forward and to get to a better place. I just want to share that with you. That's a very long teaching, actually. But I just wanted to let you know that hope is always bringing you to the possibilities. I was offered tobacco to do an opening prayer. I accepted, and I'm going to just get into it. Abuju, Manitou, creator of all there is. I'd like to call in all of our supporters, our ancestors, our spirit guides, angels, wherever you look to know that we're not alone. So, as above, from the sky world to our place on earth, Nima Ma'aki, and to the east, Wabanang, to the south, Liwanganang. You look to the west, Dinabanang, and we look to the north, Giwitinen, as above, as below, as throughout. We are the center of this journey, and we walk with the Creator, and to know that we're never alone. May you be blessed with this gathering for the next day and a half. Miigwech.
Thank you, Bishomis, for sharing these words with us tonight and for helping us begin this conference in a good way and for being a guiding voice to us at CancerCare Manitoba. And now I would like to share our land acknowledgement. To begin this event, I'd like to take a moment to reflect on the traditional territories where CancerCare Manitoba, our community cancer programs, and other Manitoba Health Services are located. CancerCare Manitoba Health Services across Manitoba are on the traditional land of the Anishinaabe, Anishinaabe, Dakota Oyate, and Dene peoples. We acknowledge that Manitoba is also located on the homeland of the Red River Métis, and northern Manitoba includes lands that were and are the ancestral lands of the Inuit. CancerCare Manitoba acknowledges that colonial practices and policies have impacted the health and well-being of generations of First Nations, Métis, and Inuit who continue to experience inequities and obstacles in accessing health care, including cancer services, across our cancer continuum. At CancerCare Manitoba, we respect the spirit and intent of the treaties and treaty making and remain committed to working in partnership with First Nations, Métis, and Inuit peoples in the spirit of trust, reconciliation, and collaboration while also improving cancer control and outcomes for all Manitobans. For me, truth and reconciliation is not a single action. It's an ongoing practice that requires humility, self-reflection, and a commitment to shift our assumptions about how systems should function and how healthcare should be delivered. I have come to understand how, when we value both Indigenous and Western ways of knowing without placing one above the other, we can begin to meaningfully address the deep health inequities Indigenous peoples continue to face. This means understanding health not only as something clinical, but as something deeply connected to land, culture, community, and relationships. Recognizing and honoring both ways of knowing creates a more relational and holistic approach to care that strengthens care for all Manitobans and leads to better outcomes and experiences across the system. We strive to reflect and honor our commitments throughout our conference. And now, to get us prepared and ready for the actual conference, I have some housekeeping notes or reminders, I guess, for the event. So one of the things that's really important is thinking about and being mindful of respectful engagement. During the question and answer period, you can ask questions, but please remember that everyone that's participating tonight has a different cancer journey. They identify and live different life experiences, and we just want everyone to think about that when you're asking questions. It's important for you to know that any questions which are not appropriate or disrespectful language that may be used will be removed, and the question and answer box will be inactivated for a person if they choose to make that type of a comment or entry. So our goal, I guess, throughout this conference is to ensure that we are respectful and that we are free of any discrimination, harassment, or harmful messages or behaviors. And we certainly want this conference to be a safe environment, and we want everyone to feel welcome and open to sharing and asking different questions. A little bit of information for anyone who perhaps is finding that they might be in need of counseling support. We know that when we're talking about cancer or talking about different difficult experiences around having cancer, someone may feel that they need to speak to someone more urgently about how they're feeling. They may be feeling anxious and overwhelmed. And if you feel like you're having that kind of a crisis experience, please call the clinic crisis line. That's at 204-786-8686 or 8686. There is a toll-free number as well, which is 888-322-3019. And that information is also going to be posted in the chat feed. so it can be viewed or looked at throughout the conference as we're going through tonight and tomorrow. If you're interested in making an appointment to see one of our counselors at CancerCare Manitoba, for yourself, if you have cancer, or for someone who's supporting a person, a caregiver, family member, you're welcome to do that. You can call CancerCare. We have counseling services that are offered at no cost, and we are open between 8 and 4:30 Monday to Friday. You can call our main line at 204-787-2109, or you can call toll-free at 1-866-561-1026 and certainly make an appointment. Just a couple of things to think about around the question and answer button that you have. So during sessions, normally we take questions at the end of the session, and you can also enter them though as they come to mind. What'll happen is questions will be reviewed and selected. Sometimes people are asking similar questions, so those will be posted, and then whoever is speaking will be able to respond to the questions. And I think the only other thing is that questions that have any detailed personal health information or personal information about your specific situation won't be shown during the Q&A. And we encourage patients to reach out to and contact their care teams directly, either at CancerCare Manitoba or the local community cancer program. And then you can ask your questions about your personal situation. A little bit more information, if I could get the next slide, please. A little bit more information about navigating Zoom. So you're on Zoom tonight, and what we wanted to point out is that you can activate what's called a closed caption below. So if you want to be able to see what's being said at the bottom of your screen, that can be a really great tool. Please be aware that it's computer generated, and we can't guarantee how accurate that is. But you certainly can put that on, and you can do that by clicking the square that has 2 capital C's inside, and that should be at the bottom of your screen. Once a session has ended, you'll be taken from that particular session back into the lobby, and from there you can click on the next session and you can join that. So you have those options. We have some really, really good information, and I would really encourage you to visit our information and resource booths. Those are all virtual. They're titled exhibitors. There's a button you can click on at the top of the screen, and then that'll take you into the booths, and you can click on different, information booths, whatever you'd like to find out more about. And if you find that you need some technical assistance with Zoom, please click on the chat icon, and a staff member will be happy to help you. So those are the housekeeping notes for tonight. We have another very exciting thing that's going on. It's called gamification, and you'll see some prizes up on the screen. So this is to really try to create some competition around participating. And you can earn points by joining sessions, by asking questions, and by visiting those booths that I just mentioned. So the top 5 point earners will receive a prize, and we have some really fantastic prizes. We have a gift basket that has skincare and makeup from our Look Good, Feel Better program. We have some really amazing cookbooks that were donated by McNally Robinson, and then we have some wonderful t-shirts and a sweatshirt that was donated by our very own CancerCare Manitoba Foundation. So if you'd like to revisit any of the information that I've just been sharing, and I know there's been quite a bit, about the event and the Zoom platform, it's also available in the resource section of the event. And you can get there by clicking on the Resources tab, which is on the left side of the page. Okay, so now it is my pleasure to introduce Dr. Kent Stobart from CancerCare Manitoba. He is our President and Chief Executive Officer, and he's going to help us open this evening and bring greetings on behalf of CancerCare Manitoba. He joined us on November the 1st, so very recently, And Dr. Stobart is a clinical pediatric oncologist and accomplished healthcare leader with extensive experience in oncology services, medical education, and health system administration. He is a Canadian certified physician executive. He brings proven expertise in leading teams, advancing system improvements, and building collaborative partnerships across clinical and academic settings. Most recently, Dr. Stobart was the Vice Dean of Education and Professor at the College of Medicine, University of Saskatchewan, and a practicing pediatric oncologist in Saskatoon, not too far away from Manitoba. Dr. Stobart is now returning to join us in Manitoba and CancerCare Manitoba, where he started his practice as a pediatric oncologist from 1994 to 2002. Welcome, Dr. Stobart.
Good evening. It's an honor for me to be here this evening with you to bring greetings on behalf of CancerCare Manitoba. As mentioned, I am Kent Stobart. I am the President and CEO of CancerCare Manitoba and a children's cancer specialist. I've just recently returned to Manitoba and CancerCare Manitoba, taking on the role of President and CEO on November 1st. This is day 14, but I'm not counting. I've come back to Manitoba from Saskatoon, where I was the Vice Dean of Education at the College of Medicine, University of Saskatchewan, and where I practiced as a pediatric oncologist. As mentioned, I joined CancerCare Manitoba in 1994 and started my career here as a pediatric oncologist and bone marrow transplant. In 2002, my family and I moved to Alberta for a few years. I have so many warm and heartful memories of those years here, of the children I cared for and their families. A few of them have kept in contact with me over the years, and it's very good to be back at CancerCare Manitoba. One of the reasons I came back was to be back and closer to patient care once again. As a strong proponent of medical education, I know the importance and the value of education and its vital role in the healthcare system, shaping how healthcare is delivered. In fact, CancerCare Manitoba's mission states clinical care, research, and education. For physicians and healthcare providers, continuing learning is fundamental to clinical excellence, ensuring that our skills and knowledge remain current in a rapidly evolving field. Likewise, for you, as patients, families, and caregivers, education is vital and empowering. When people understand their diagnosis, their treatment options, the side effects, the self-management strategies, they are better equipped to participate in decision-making and advocate for their needs. Good patient education improves safety, enhances adherence to treatment, reduces anxiety, and promotes better health outcomes. It also helps families feel more informed and supported as partners in patient care, particularly during complex or emotionally challenging moments. Ultimately, education creates a shared foundation of knowledge and confidence for everyone involved in healthcare. It strengthens trust, it strengthens communication, and it strengthens collaboration. And most importantly, it contributes directly to a safer, compassionate, and more effective care. One of the priorities of our roadmap of cancer control for Manitoba is to ensure an exceptional, person-centered experience is at the heart of every interaction. One piece is to ensure that we improve access to information, as well as opportunities for patient and family input into the services that we provide. Our commitment to patient-centered care means we want to hear from you. We want to work with you. We want to provide the best care possible, taking into consideration your and your family's unique needs. We know that patient-centered care goes beyond treatment of your cancer. It includes providing the supportive needs for patients and their families, physical support, emotional support, and educational support. Through the Hope and Healing program, we want to increase and strengthen our supportive programs and services for you as patients, families, and caregivers. We want to walk with you through that cancer experience, which can be difficult. As a pediatric oncologist, it is both an honor and humbling to walk alongside patients and their families through their very difficult times, and to know there are a host of other providers, care providers, ready to support you in the most difficult of times. As I close today, I want you to know that CancerCare Manitoba is here for you. We are in a strong position to continue delivering outstanding care today and into the future. I have seen firsthand the education, the compassion, and the professionalism of the staff and physicians who provide care here every day, including those you will hear from today and tomorrow. We have refreshed our roadmap for cancer control for Manitoba. There is a new vision and mission, a renewed research strategy, and a new building on the horizon. The future is bright for CancerCare Manitoba, but more importantly, for the people of Manitoba. I trust this conference will be of great benefit to you. As you listen and learn, you will feel the support of our healthcare providers and their community, of other patients and caregivers. There is strength and there is support in this community. Thank you for the opportunity to bring greetings today.
Thank you very much, Dr. Stobart. And now it is my pleasure to welcome Dr. Donna Turner, who is our Vice President and Chief of Population Oncology. She is an epidemiologist and has worked at CancerCare since 1999. Most recently, she was CancerCare's interim CEO. So Donna, I'll turn this over to you to talk about what's new at CancerCare.
All right. Thanks very much, Lorena, and thank you, Dr. Stobart, for bringing such warm greetings, and thank all of you for joining us today as we're sharing with you information that you'll find helpful, but also we are looking forward to hearing from you as well about questions that you may have, so that we can make sure that we're reaching out to you with the information that you need. So I was asked to talk about, a few things about what's new at CancerCare Manitoba. Well, it has been an incredibly busy last year, and so I put together some ideas, a few things that I think you will be interested in hearing about in terms of the things that are new for CancerCare Manitoba. So one of the things that we like to talk about is how we anchor what we do and what we know in data. And this slide, well, although it's in some ways a little bit busy, really focuses us on thinking about what we know about how many Manitobans are diagnosed with cancer every year. And when you look at this graph, you can see that the dark purple bars on the left talk about the total number of Manitobans diagnosed with cancer between about 1998 and 2021. And then in the light purple bars, you can see the numbers that we expect to see and coming through us all the way up to 2046. This information is provided to us by the Manitoba Cancer Registry. We're really fortunate that in this province, the reporting of cancer is actually required under the Public Health Act, which helps us to understand what's happening with cancer, who's being diagnosed with cancer, what kind of cancers they're having, and are we actually moving forward. So this slide shows us that cancer is increasing, and we know that cancer is increasing mostly because our population is aging and it's growing. And just on the basis of that, we know that about 2% more people are diagnosed with cancer in this province every year. Now, this might sound like a lot, and for some people, it's a bit of a surprise. So that really just doing that back of the napkin math, you can see that in 5 years, there are 10% more people diagnosed in that 1 year than there were the 5 years previous. Now, the good news is that we know so much more about cancer. We know also that people are surviving their cancer diagnosis far more than they ever used to. And so despite the fact that we can see that cancer is increasing and that we are going to be a busy organization supporting and caring for people going forward, we also know that the future is looking good. We have so many more drugs that are available and more treatments, including new kinds of radiation, new kinds of surgery. All of these things are helping us to be able to treat patients better. We also know we can find cancer better with screening programs and better diagnostic techniques, and these are really helping us to be moving forward and offering those treatments that have a good impact, because we're finding cancers earlier when they're actually better to treat. So that's the first thing that I wanted to share with you about what we know about cancer in Manitoba. It is still continuing to grow, but there is a lot that we are able to do about it. So one of the things that we do about it, and already this has been mentioned, that we have a new roadmap for cancer control. This is our strategic plan. And in 2020, just before the pandemic started, we managed to get everybody together and talk about what we were going to do in terms of cancer services from 2020 to 2025. There was a little bit of a wrinkle that was thrown into things with the pandemic, but we actually managed to achieve many of the things we set out to do in that original roadmap. So starting in 2024, it was time for us to have a closer look at what we had said we were going to do and ask ourselves, are we doing the right things still? Are there things that we should be doing differently? And it's those things that I'm going to share with you right now. One of the things that we did is we had a good look at our vision statement, and our vision statement used to be a world free of cancer. Now, that's a very aspirational vision, and certainly one that we would all really love to have, but we also realized that people were really struggling with how to get their arms around that kind of a vision. So working with our board and many of our advisors, we changed the vision, and it's now leading the way in cancer control. And so that's a really great vision, because it means that no matter what we are doing in cancer, whether it's research, education, screening, treatment, hope and healing programs, we are always striving to lead the way. And this is great news for patients and for all Manitobans. You'll see that our mission statement is also shared on this slide, and it really talks about, in very specific terms, we're aiming to reduce the risk and impact of cancer for all people of Manitoba through world-class cancer control, which is basically cancer control is everything we do from prevention and screening through treatment and then supportive care, but also research and education. Now, we ended up focusing on 5 priorities, and I'm sharing them here on this slide, and I'm going to summarize them for you. But one of the things that I want to say right off the hop is this is not in order of priority. We're not aiming to do priority 1 and not do priority 2, 3, and 4. This is just the way that we think about the cancer journey, starting with prevention and screening, moving through treatment, person-centered care, a workforce and system that's sustainable, and last but very much not least is working with our First Nation, Métis, and Inuit peoples. So you can see that there are 5 things that we are aiming to do. You're going to hear in the next day and a half, you'll hear from people that will touch on many of these things as we go through. But just to really know that CancerCare Manitoba is focused on being a leader in cancer control, and in particular by focusing on these priority areas. So just to take a moment to look at that and think about starting with preventing cancer when we can and finding it early if we can't. That's priority 1. Priority 2 is making sure that we are delivering the best quality, state-of-the-art cancer care and treatment. Priority 3, and Dr. Stobart mentioned it already, is ensuring an exceptional person-centered experience is at the heart of every interaction. And I really love the way that this is worded, because it speaks to the heart and how CancerCare Manitoba is not about treating cancers. We are really looking at supporting people who are experiencing cancer. So it's important that we really acknowledge publicly that we are looking to be to making sure that we are person-centered. We are wanting to work with you, the patient, and that you are a person, and we understand that and see you as a whole person. Priority 4, is to ensure our workforce is strong and our system is going to be sustainable. And so one of the things that we've really highlighted here is the importance of our staff. This is something that we thought needed to be strengthened from our last one, as our staff are our biggest resource. And so really for us, a huge investment on staffing is number 4. And then number 5, our moral imperative, the importance of us delivering culturally responsive cancer care to improve outcomes for First Nations, Métis, and Inuit peoples. And this is to be done in partnership with our First Peoples, not just something that is done to, but with and for our First Peoples in a way that makes sense and that we'll co-create these programs with them. So in addition to the roadmap, the updated roadmap on the left, we also have released an updated research plan. This information, and you'll see it a little bit later, can be found on our website under our corporate publications, under About Us, and you may be very interested in having a look at the things that we're prioritizing going forward. In cancer, research is absolutely essential. Research today is today's treatment, not just tomorrow's treatment. So our research partnerships are very important to us. So what else was new? Well, many of you may be aware that there was an announcement in June by the Premier of Manitoba about a second building for CancerCare Manitoba. And so this slide shows you the site of the new second building. So this is not a replacement of our current building at the McDermott Avenue site, but also we're going to have a second building on what's shown as the open field there on the corner of McDermott and Sherbrooke. It was a very exciting day. You can see many of the people that were there at that event. And just a little sneak peek of an artist rendering of what we think that new building might look like. So lots of planning is underway. The Premier challenged us to say that he would like to have shovels in the ground, and so building to start by August or September 2026, and that's right around the corner. So lots of planning is underway in that regard. Now, you've already met our fourth exciting thing that has happened at CancerCare Manitoba, Dr. Kent Stobart. He's introduced himself, but in case folks missed his words, just to say that we are so pleased that he is returning to Manitoba, having done some stints at other provinces to the west of us, but really pleased that he is here, and as a pediatric oncologist and a leader in terms of administration and education, brings just a wonderfully diverse wealth of information, expertise, and compassion for us. And so we're really looking forward to, with a new plan, a new building, and a new CEO, things are looking very, very bright. Now, we do have a number of new communications out as well, and I've talked about already the roadmap for cancer control as well as our research strategic plan. But many of you as patients will be aware that our patient and family guide was updated this year as well. And then it was about 10 years ago that we last did this, and so we really had our communications group in partnership with our care teams and especially with the Hope and Healing team. Really, we're talking about what would be important for patients to know and to do. So please go and have a look for that guide. I think you'll find it very interesting. And in addition to that, our strategy for the Hope and Healing program, and I'm going to come back and talk about this a little bit more, but it's been really interesting journey to really reimagine what our Hope and Healing program could look like, distributed across the province, and really bringing together all the supports that we do for patients in that one program. One of the things that we did, and this is under some of the publications, we realized as we were creating these publications that stock photography was not going to do it for us, that we really wanted to feature real Manitobans in our documents and in our materials. And so we have a couple of things that we have been doing. Our communications department is putting out a call every now and then, so watch social media and other places for this. We are looking for everyday models. models. And so real Manitobans who've had a real cancer experience. And if you are interested, you'll find some information in our, and you can reach out to our communications department. You can get your name on the list. And so next time that they have their photographers in, you may get a call. And these individuals are real people who have given us permission to use their pictures and their stories in our publications. And it's just made it so much more genuine in terms of the publications that we do and the communications we have. And this has really spawned onto other things, and that we, when we're talking to these real world models, we find out their story. And their stories are so impactful, and you can see that we've included so many stories on our website, in some of our annual reports, but also our social media. And we're really proud of this, making this face much more Manitoban. So just a little bit more about the Hope and Healing Center. A couple of things that really speak to where we're going in terms of the Hope and Healing program. We're not looking to have this just be a Winnipeg thing. In fact, we're looking to spread this around the province. And so there is a new center that is being built and will be opened at the Boundary Trails Center. And as well, there is one already, you can see here, just being finished in Brandon at the Western Manitoba Cancer Centre. And so excited to be able to offer places for patients to meet their support team to talk about, and also to have things like physiotherapy or art therapy or support groups. These are things, watch for these, stay tuned. But just to note that for those of you who are tuning in from around the province, this is one way that we are looking to have places for cancer patients to come and to be supported and to share their experiences. So there's some other things we've been doing in terms of communications, and I wanted to just talk a little bit about some of the things we're doing in terms of cancer screening. There's just a few things we've done in the last year. The very first one on the left is our colon check, so our fecal immunochemical test. You can, some of you will get them in the mail. Some of you might want to write to us by going to our website and asking us to send you a kit if you're between the ages of 50 and 74 and you don't have any symptoms and you have not had cancer. That we ask people to write to us, and we will send you a fit kit. And this is our efforts to be able to identify colorectal cancer early and to provide those treatments when it's most effective. The other piece that we wanted to show is about lung cancer screening. So right now, many of you will know that we have 3 cancer screening programs: breast check, cervix check, and colon check. And our new baby on the way is lung check, which is our lung cancer screening program. And it will be aimed at people 55 to 74 with a fairly extensive smoking history. And we will be offering with our partners low-dose CT scans, we're expecting to start next year in 2026, but we've already started working on some of the materials. So just so that you know that the world of screening continues to expand with new types of tests like we have for colorectal cancer, but also whole new screening programs like we do for lung cancer screening. And the last thing I'm going to talk about, some of the things that are really new and exciting, is some of the messages that we have in cancer prevention. Now, it's really important that people know that there are some things we know that people can reduce their risk for cancer, but we also know that there's no guarantees. However, and we hear from patients sometimes that talk about, or people that talk about somebody who has done everything right. They've lived well, they don't smoke, and yet they develop cancer at a young age. And then we also hear the stories about somebody maybe who is really smokes 3 packs of cigarettes a day and likes to eat fried food and doesn't exercise at all, and yet that person might be over 100 years old. Well, that is what happens sometimes, but we know that of the people who actually, there are certain things that if people do more of, like if you smoke more and if you eat less healthy, your risk of developing cancer increases. And we also know that there are some things that you can do that actually might reduce your risk. So one of the things that we want to share with people is to make sure that they are aware of what we know. And sometimes we hear from patients especially that there are, that they would like to know how they can help their loved ones to avoid having a cancer diagnosis. And so one of the things that we've been doing is our prevention campaigns, and they're really targeted actually at younger people, people in the age groups of from their 20s to their 40s, where people can actually make a change in their lifestyle so that 20 or 30 years down the road, they have actually reduced their risk for cancer. So we've done this in a couple of things. People might be surprised to know that physical activity is actually the second biggest thing that you can do to reduce your risk. So the number one thing is not to smoke. The second thing you can do is actually to be physically active. And so we've really been, you'll see in some of the campaigns that we have, that we've been really promoting this, that people understand that actual physical activity can actually reduce your risk for cancer down the road. Some of you will have seen our alcohol campaigns, because alcohol is also a carcinogen, and so we're really encouraging people to think about the role of alcohol in their lives and make different choices. So our prevention campaign this last summer focused on social media, videos, billboards, and also we did a lot of focus group testing of our campaign. And so we ended up with this campaign, and it was interesting that what really resonated with the young people, and you can see the age groups in the top there, sort of people between the ages of 18 and mid-40s. The campaign is focused on saying what cancer loves and what cancer hates. So cancer hates counting steps. So the idea here is that cancer doesn't like it when you're physically active. So get out and get active. For many of our younger population, the idea about doom scrolling, that's just when you're on your phone and you just scroll and scroll and scroll and you're not moving. And so the idea to get people to making sure that they are moving as well. So these are some of the things that you will see and that we hope that you share with many of your family and your neighbors as well, about talking about what they can do to reduce their risk for cancer going forward. So that is the end of my presentation. I think there's a few questions that we can have, and so I will take a few of those questions now. The first question that we have is, what will be done to ensure care remains person-centered as you grow with more patients? This is a really great question. We really are always focused on the patient. We try to make sure that we talk to patients. We ask patients to share their experiences with us in clinic, yes, but some of you will have received patient satisfaction surveys from us. We want to make sure that we hear what we're doing well and what we're not doing well, so that we can change and we can improve that. So it's really important to us, and we talk a lot as a staff about the importance of being patient-centered, and so always the patient is at the center of our thoughts as we're working forward. Even though we can see that the number of people being diagnosed with cancer increases, each person diagnosed with cancer has their own journey and their own story, and we need to make sure that they are at the center of that care and our conversations. So the next question that we have is, what is the percentage of First Nations ancestry, and can you explain contributing factors, i.e. diet, access to foods, and lack of early testing? So I think what the person here is asking is about the percentage of people who are diagnosed with cancer who are First Nations. At this point, we don't know that number exactly. More recently, we actually have a number of efforts that we have right now where we're encouraging people as part of the healthcare system to identify as First Nation, Métis, and Inuit. And then with communities, we'll be working with that information and be able to really talk about the differences that we see in terms of access to cancer services and outcomes in terms of being First Nation, Métis, or Inuit. But it's really important that that there are many, many factors that go into somebody's increased or decreased risk of cancer. And there are things that all of us need to think about, and that quite often it's not just about somebody's family history. It is about the way that people live, the access they have to food, the supports that they may have in terms of access to primary care, so that if they have symptoms, that they have easy access to those individuals. And of course, there's screening. So there's many things that we are really looking for, looking at all Manitobans to make sure that we understand that the development of cancer is complex and involves many factors, where we come from in terms of our family history, but also the way that we live, and making sure that if there's something wrong, we go and get treatment for that right away, that we go and see someone. So if anything is not right for you, or something is not right for one of your loved ones, please encourage them to go and see their healthcare provider right away, so that more testing might be done to make sure we find that cancer as early as possible to treat it effectively. So with that, that's the end of my session. Thank you all for your questions. I think there may be more, but we're tight on time. And I don't want to stand between you and our excellent keynote speaker for this evening. The person that I have the pleasure to introduce to you is Dr. Sarah Dentry. Dr. Dentry is our Director of Research Operations and Administration at CancerCare Manitoba. But she is a psychological neuroendocrinological researcher. Try to say that a couple of times quickly. And so as she was in her research capacity before she joined CancerCare Manitoba, Dr. Dentry has skied to the North Pole and climbed the highest mountain in Antarctica to measure human performance in a natural environment, taking the science outside of the laboratory. She has investigated the psychological, biological, and physiological components that enable a person to thrive and perform in stressful, high-intensity situations. So prior to immersing herself in research, Dr. Dentry served 10 years in the Canadian Armed Forces and was deployed in that role as well. So she's a real adventurer, and we are really pleased that she has taken on her next adventure to be joining us at CancerCare Manitoba. And Dr. Dentry is going to give us a excellent presentation about, which I'll let her introduce. So over to you, Sarah.
Thank you, Donna. I just want to say thank you for inviting me to speak at this year's Cancer Patient and Family Conference. It's an honor to be here tonight, and to share with you some of the research and stories that I've gained from polar expeditions, which I do hope will be helpful and at the very least interesting. As Dr. Turn just mentioned, prior to joining CancerCare, as the Director of Research Administration and Operations, my own research focused on how people can continuously thrive in very challenging situations. My area of research is called psychoneuroendocrinology, and yes, it is a very long word, but it basically breaks down to understanding how a person's perceptions can activate the different areas of their brain, which in turn can trigger certain hormonal responses based on that perception. And then those, which is called your endocrine system, so psychoneuroendocrinology. I'll get into that in more detail as you'll see further on in this presentation. I'll start pulling some of that into some of the expedition stories that I'm going to tell. But for tonight, I want to provide you all with some of the stories from the expeditions and some of the research that I conducted while on them, and the lessons I learned about how humans can thrive even in the most challenging situations. All right, so in 2014, I was invited to join an expedition to the North Pole. It was something I couldn't refuse. I've always wanted to go to the North Pole, and I loved skiing. This expedition involved 53 participants who would be skiing while pulling sleds with all of our equipment, and those sleds would weigh 100 to 150 pounds, and we'd also be wearing backpacks that weighed 80 pounds. We'd be covering over 200 kilometers, skiing over the Arctic Ocean to the magnetic North Pole over 10 days. Since I was interested in stress research, I thought this was actually a perfect opportunity to do some research on the expedition. So back then, at that time, my research was very interested in understanding PTSD. Half of the participants on the expedition, the 53 participants that went, half of them were military veterans, and all of them had injuries from their military service. These included things like amputations to their legs, to their arms, spinal injuries, back injuries, or blast injuries where they couldn't feel half of their body, their nerve endings were destroyed, or other physical or mental injuries. The point of this expedition was to pair the military veterans with civilian mentors who would use the experience as a starting point to help them transition into their civilian lives, coming out of the military and going into the civilian life. My research was kind of a side project on this, and my aim was to better understand, using real-world experiences of the expedition, the changes in certain biomarkers of stress, namely cortisol, salivary alpha amylase, interleukin-1 beta, interleukin-6, and nerve growth factor during the polar expedition. These are all purportedly to be great biomarkers of stress reaction back in 2014. My plan was that I would join the expedition, collect the saliva samples every day in little Eppendorf tubes, and then also have the participants self-rate their perceived levels of stress each day from the different experiences that they've had. Now, for those of you who haven't been on a polar expedition before, some of the naturally occurring challenges and stressors of expedition life include the physically strenuous activity. Those 100 to 120 pound sleds and 80-pound backpacks don't carry themselves. So we either had to carry them or we didn't have supplies. We were completely self-sustaining on this expedition. So all those sleds in that picture there held our tents, our sleeping bags, our food, everything in our fuel to cook that food, everything we would need while on the polar ice. Some of the people on the expedition had never used skis before or had very limited experience using skis or snowshoes and got to choose between skis or snowshoes. And they were struggling to try to get to grip with that new equipment, while on the same time trying not to hold up everyone else on the expedition. So this is some of the different types of terrain that we had. In my mind, I thought, well, I'm skiing to the North Pole, it's going to be flat. And from Manitoba, I'm used to nice flat prairies. Well, there's actually mountains up there. And so we had to ski up these mountains, pulling these sleds as well. And then there's the extreme cold. It's a constant cold. There's no escaping the cold on polar expeditions. There's no buildings that you could go to. You're carrying these tents. The tents are thin. So every day you have to put the tents up, and then you also have to build wind walls, these snow walls, in order to block the wind that was coming across the sea ice, in order to try to provide some sort of isolation from that wind. So as I mentioned, the terrain was a challenge. This picture here is a pressure ridge. This is where the cracks in the ocean ice push up against another crack in the ocean ice, and it creates these ridges. And these could be higher than 6 feet sometimes. As you can see in this photo, this was a particularly large one. When we encountered one of these and we couldn't ski around it, because sometimes they would be huge, we'd have to scramble over it with our skis on and our poles, and then we'd have to pull the sleds, the 100-pound sleds up as well. So there's a lot of the terrain challenges as well. And as I mentioned previously, half of our team had injuries from their military service, including amputations. We had some sit skis for our participants or other accommodations, and this helped them in order to navigate over the snow. And we would take turns as a whole expedition team to help pull some of these participants so that they wouldn't have to do the entire expedition with just their arms. And those who had blast injuries and couldn't feel their body, we'd have to constantly be watching to make sure that they didn't get frostbite because they simply couldn't feel the cold. as well, this is 2014 and Google Earth was a new thing. And we were actually asked to take the Google Earth camera with us. So on top of pulling all those sleds, this is a picture of me with the Google Earth camera on my back. On top of pulling those sleds, we also had to take turns carrying the Google Earth camera. It turned out, and we carried it the entire time, it turned out that the batteries for the Google Earth camera couldn't deal with the extreme cold. So even though we had to carry it, we didn't actually get the footage. I was looking forward to seeing the trek on Google Earth, but we didn't get it. But then also our breaks. So that picture on the right there, that's one of our breaks. We would ski for a total of 10 to 12 hours every day. And we would ski for 2 hours at a time and then get a 5-minute break. In those 5-minute breaks, you had to quickly adjust your clothing. You had to quickly get a sip of warm water from a thermos or eat a granola bar or relieve yourself if you have to go to the washroom. And then you have to be ready to go right at 5 minutes. This was a bit of a stressor for the non-military participants on the expedition who weren't used to strict timings, and also the shame of being the one that's holding up the rest of the group. So it ended up actually being a major stressor for some people, but they were quick to learn. And after about 3 or 4 of these breaks, they've got into the role of things, and they were the first ones to be ready near the end. And that extreme cold that had no escape. This is a picture of us putting up our tent at the end of a very long day. The tents were out right on the snow with no flooring, and there was no heat inside. Add that to the 24-hour daylight. Both of these photos were taken around midnight. So what we would do is we would just pull our little toques over our eyes, and that gave us a little bit of darkness, and we could try to get some sleep. And team dynamics is always such an important thing. Social relations with other people is a very important thing. On this expedition, we were in these tent teams of 8 people. The tents fit 8 people and no extra room. You couldn't even fit a chihuahua in there on top of everyone. All of our equipment, you can see here, all of the boot liners that are trying to dry out are hanging in everyone's faces. Everyone's kind of on top of each other, and sleeping was very cramped as well. So you had to get along with your tent mates, and if you didn't, that could also kind of cause some friction. But on this expedition, everyone got along really well with their tent mates, and we also got to walk with each other each day and chat. It ended up working really well. And so despite all of those challenges that I thought that were naturally occurring in an expedition, on the North Pole expedition, everyone seemed to be thriving. They all seemed to be smiling and having a good time. I mean, there were some challenges, some choke points there, but it was a resounding success in terms of thriving. At one point, when one of the participants who had one leg was trying to hop around on the snow, and of course he's hopping on one leg, so he'd go right down to his hips in the snow because he didn't have 2 feet to sort of balance out his weight. I asked him like how he was feeling about the expedition and whether it was challenging or stressful as he was like trying to climb out of the snow again. And he turned to me and he said, you know, Sarah, every day is a struggle. Whether I'm back at home, just trying to move across my living room, that's a struggle. I'm used to the struggle. At least here, I get to be skiing and seeing all this and being with this group. So my research on stress reactions didn't elicit a stress response from this team, but what was going on with the North Pole expedition, I wanted to find out like what exactly was happening, that their endocrine system was not activating and they were not getting negative response, even though everything was there to say that they should have been having some challenges from this whole expedition. So I went back to the lab, started to think a little bit more on this. So one of the things that I started to chew on was that adversity is not bad. Stress is not bad. That one comment from the participant who had one leg and would say, you know, even moving across the living room is challenging. I'm fine with this, as he's trying to pull himself out of the snow. You could use the analogy, I like to use the analogy of orchids and dandelions. So orchids are a flower that society on a whole tends to really prize. It's a beautiful flower. You pay a lot of money for them. But the problem with the orchid is that it needs a very specific and perfect environment in which to flourish. You change its pH balance in the soil, you change the temperature just a little bit, the lighting, the watering, a small draft, any of those things can cause it to start to wither and die. It cannot withstand adversity and change. Dandelions, on the other hand, is regarded as a weed. We do our best as a society to try to destroy them. We pull it out of the ground, stomp on it, spray it with toxic weed killer, and yet they flourish. The more we try, or life tries, to bring it down and get rid of it, the stronger it gets. Its roots adapt. They get stronger, they burst through concrete. The dandelion needed those years of evolutionary adversity to develop into the robust plant that it became. And yet society likes to look at stress and challenge as something to avoid. But really having that stress and that adversity can make you have those really strong roots and help you to get through those challenges. Another area that I started to think on was perceptions. And your perceptions are important. So one of the impacts that I want to look at when I looked at North Pole, I was thinking, well, I wasn't really capturing too much of the perceptions and how are they viewing this whole entire expedition? So how you perceive the world around you, it activates the different areas of your brain, which then triggers different responses in your body and your endocrine system, your hormones. So as an example, if you have two people, like these pictures here, two people are going to jump out of an airplane. Neither of them, as you can see, they're attached to instructors. Neither of them have had any training. They're doing the exact same thing. They're jumping on the same airplane, same conditions, same equipment, same everything. One of them, while they're jumping, will think, this is terrifying. I'm going to die. This is horrible. Like, get me out of here. Where the other one might be sitting thinking, this is thrilling. When I get to the ground, I'm going to start learning how to do this. I'm going to take lessons and all that. It's the exact same experience, exact same training and everything. It's just their own perception of what they're going through at that moment will trigger two completely different biological cascades in their body. One will be activating that fight or flight response and having a cortisol dump and all of those hormones that will be trying to trigger you to try to fight or flight. Whereas the other one will be thinking, this is thrilling and this is amazing. And they'll be having all those positive feel-good endorphins and all those hormones. But the only thing that was different was how they were perceiving the exact same situation. So taking that, I don't want to get too into the weeds of psychoneuroendocrinology, but I do want to add a couple more key components, and that's brain plasticity or neuroplasticity. Your brain is constantly evaluating its own neural connections, and it strengthens, prunes, or builds new connections based on your use, need, or injury. Your brain creates those new pathways or strengthens pre-existing neural pathways if those pathways are used often. Conversely, if certain pathways are not used often, your brain will prune it or get rid of it. Your brain's constantly looking ways to become a more efficient item. And we used to think that brain plasticity was something that ended at an early age, like after 20, your brain was no longer going to be making these changes. But we now know that brain plasticity happens throughout your entire life. And you can help it to be even more dynamic through your own experiences. So these changes can occur through different ways. You could have hormonal activity or DNA regulation, the characteristic dendritic spines, that's part of your neurons. I don't want to get too far into the science of it, but I did just want to touch on these things. But all of these things are brought to you or brought on by you, by things that you can control and do. So for example, learning something new, that's going to increase your brain plasticity. Exercising can change your neural connections, your diet or meditation, and your amounts of stress that you experience rewires your brain. Your emotions and social interactions also rewire your brain. Every day, if you're having more and more social interactions, your brain will start forming those connections and make them stronger. If you start having less interactions, your brain will start pruning those areas of your brain. They'll start cutting it back. One key area that I'm interested in is self-talk and how those perceptions that people choose to have, remember the people jumping out of the airplane, same experience, but different perception. And it was their own self-talk about the experience that they're having. The one guy was saying, oh my goodness, I'm going to die. The other guy was saying, this is thrilling. I can learn from this. I can grow. That's their self-talk, and that will have totally different reactions in their body. So there's a bright side and a dark side of neuroplasticity. Not all neuroplasticity is going to be positive. If you're constantly focusing on the negative self-talk and you're constantly engaging in stressful behaviors, then you're going to be strengthening those neural pathways that will cause you to have more of that self-talk. If you're having the negative self-talk, if you're having more positive self-talk and choosing to try to see where you can grow from situations that are challenging, you'll be strengthening those neural connections that will then allow you to continuously have those perceptions of growing and thriving in certain situations. But it doesn't happen overnight. It's something that you have to learn, and you have to recognize in yourself which path are you choosing to take yourself down, because the one that you're choosing is going to start making your brain rewire itself and strengthen the one that you're doing. So back to my research question on North Pole, it seemed to me that people's perception of their task, their self-talk, which then impacts their neuroplasticity, affects what gets turned on or turned off with regards to their hormonal cascade. By changing that first perception and working on the self-talk, you can impact how your body responds. You can actually control your body's response, that mind-body interaction. By having constant fear, you're rewiring your brain, your neuroplasticity, to strengthen a fear response. But if you flip that and you work on reshaping that internal perception of the challenge, you could begin to start rewiring your brain, your neuroplasticity, to strengthen those neural connections for a positive response to challenge. We call that thriving. And the key is you can actually control it. So we'll leave the North Pole and we're going to head to Antarctica. So taking these thoughts, I thought, what are the components that allow a person to thrive in extreme environments? Stress reactions include succumbing, resilience, and thriving. Every time someone experiences some sort of trauma or some sort of negative challenge, their first natural reaction is to succumb. You'll have a decrease in your previous performance level. But then most people will be resilient and they'll come back up to that previous level, and that's called resilience. But there's some people that are able to thrive. So after they've experienced a traumatic event or an extreme challenge, they will have that moment of succumbing. They'll come back up to resilience, but then they'll also take that experience, just like the dandelion that had that negative experience of being squished and pulled out of the ground. They'll end up, if they can learn from that and grow stronger roots, then they'll be thriving after that experience. So I really wanted to try to understand what's going on when people are thriving. So instead of emphasizing resiliency, which seeks to simply survive challenges, I wanted to start understanding what is bringing on that thriving. What's going on with that dandelion? What's going on with the skydiver who loved it? So instead of focusing on stress avoidance and the negative aspects of stress, I started to look into thriving and durability, which is holistic, positively framed concept encompassing physiological, psychological, sociological, nutritional, and sleep components. All of these things are very important for being able to thrive. And recognizing that you needed to have stress in order to be able to grow. So in January 2016, I was invited to join a large team which aimed to climb the highest mountain in Antarctica. It's called Vincent Massif. And I was asked to be the expedition lead researcher. On this expedition, we would have 32 people, again, with a mix of military personnel and civilians, just the same as with the North Pole. The military veterans had pre-existing injuries from their life in service. For this expedition, I collected biological and physiological data similar to the North Pole expedition, but this time I added interviews to get a better understanding of how they were perceiving the different challenges that were presented to them on this continent. So I'll just go back to this one. So on this expedition, the Vincent Massif climb, this is a map of the expedition climb. It was going to be a 10-day ascent The summit elevation was 16,000 feet. The reason why it takes 10 days to climb a mountain like this is you'd climb about 3,000 feet in one day, and then you'd need about 2 days in order to acclimate to that next altitude so you don't get altitude sickness. So each day we'd have that significant elevation change. There'd be dangerous crevasses and seric fall exposure. I'll show you some pictures of that in a moment. We had heavy snowfall delays, technical challenges, because this is mountaineering now. We're climbing a mountain. We had fixed ropes and ascenders. And there's also a number of crux points where participants faced physical, psychological, and technical difficulties. So going into Antarctica, we caught a huge Russian plane in Chile and then flew to Union Glacier. And this is the airplane touching down in Union Glacier in Antarctica, which is kind of in the center of Antarctica. I wasn't on the coast. I didn't get to see any penguins in Antarctica, which was disappointing, but we were right in the middle of Antarctica. So there was no birds, there's no life forms that we know of because it was just so cold and it's a desert. These trucks then picked us up on this is on a glacier. You could see the ice, you could see the reflections of the truck's tires underneath. And these trucks would then take us to Union Glacier camp. So this is a permanent camp that's run by, I believe, a British team. I can't remember, but there's a number of these different camps on Antarctica that are there to support researchers and expeditions and such. And so this one is Union Glacier. And it had a nice cook tent set up that you can see is that blue tube type looking building. And the pictures at the bottom are inside that. And then at night, we would just sleep in those tents out there. And then we tried to pass our time because we had to wait for perfect weather for the Baslers, which are another type of plane, to come and pick us up to then take us to the mountain that we're going to be climbing, to the base of the mountain. So we had a lot of time that we were just kind of trying to pass the time away. So we played volleyball and soccer and such. And then the Baslers, these are the Baslers, they finally arrived and we then were a go to get to Vincent Massive. So it all goes very quickly. It's a lot of waiting around and then suddenly it's time to move and you just load up the plane and next thing you know, you're up in the air. So this is a photo I took looking out of the window at the mountains as we flew over it. And it's really something when you're up there and to think that you're looking out at a landscape that no human has actually touched. And you see that snow, but you're just thinking like underneath are glaciers and just what's under there and you just don't know. And it's just awe-inspiring to be on a continent like that where it's so isolated. So they dropped us off and then they take off. They drop your kid off and then they leave you. And so this is now we're at the base of Vincent Massive. So we set up our tents at the base. This is our base camp here. At the base camp, we spent a couple of days, 1 to 4 days, just preparing our equipment, making equipment cache at half camp to help us with the first day, and just getting acclimated to the altitude at base camp because we don't start at sea level. You do start on top of the glacier that's on the bottom of the mountain. So we're getting acclimated to the altitude there. Again, it was a lot of sitting around and waiting. That tends to be a huge stressor for people on expeditions, is just not having that control over when you're going to move and not knowing, because on the expeditions, the weather and the conditions basically tell you when you're going to move. So on day 4, we finally got to leave our base camp and start moving up the mountain. It's a slowish pace. We had to go 2,000 feet of elevation. So we're going up 2,000 feet in that one day. It was over 9 kilometers, the walk. So it's a gradual incline. And again, just like in North Pole, we were pulling 100-pound sleds and carrying 80-pound backpacks. And we were on a gradually rising glacier. And you could see in the background there, so this was we're all on these rope teams. This was my rope team leader, and you had to be tied into the rest of your teammates. And so we all had to walk in lines because when you're on a glacier, you never know if there's going to be crevasses, which are the cracks in the glacier, and you could fall down. Some could be extremely deep and they're very dangerous. And so you're all roped into your teammates. And as the person in front of you takes a step, you take a step, and you have to keep your rope tight. if your rope gets slack and say there is a crevasse and you fall down, if the rope's slack, physics will then mean that you'll ping off the rest of your teammates and they'll all fall into the crevasse with you. But if the rope is tight, it's less pull on the rope if you do fall into a crevasse that's underneath the snow. And that there is some serac fall. So basically it's the glacier on top of the mountain that's coming over and they break off and fall down. So this was also a very dangerous part of the expedition. We were on the glaciers, we were worried about the crevasses, but we're also worried about the glaciers falling on top of our heads. And also actually during that first day, I developed high altitude cerebral edema, which is your brain swelling. There's no rhyme or reason to understanding who develops high altitude sickness. I've been at higher altitudes than that particular day before. I never had any issue, but for some reason, the conditions were such that my brain decided to develop high altitude cerebral edema. So I ended up getting a shot of dexamethasone, which then, and just slept for 2 days, which was good because we were on our day 4 to 7. We had to just sleep or just hang out and acclimatize to that next new altitude level. And a blizzard had moved in. So in Antarctica, it's a desert. They don't receive much snow, especially in this part of Antarctica. And in that 24 hours of the first day that we're at low camp there, we received more snow than that area receives in 2 years. We received more snow in 24 hours than they receive in 2 years. So we were stuck. You can see some people are coming into the camp. We're stuck there. We had to wait out this blizzard and then make a plan of what we're going to do next. We ended up being delayed for 3 years, and this caused significant stress for many of the team members because, again, they didn't have any control over the situation. So I decided to conduct some interviews during this time, and everyone's just trying to keep good spirits, but their nerves were really getting frayed. People were on edge. We were on this expedition, we were in 2-person tents, and the extreme UV in Antarctica means that you don't really want to be outside on the snow unless you could avoid it. So a lot of times we had to sit in our tents with just one other person. So team dynamics were getting a bit frayed. We had no control on timings and movement, and we didn't know when we'd be able to move because the snow just kept on coming. And this is just a photo of inside our tent. You can see it's, just having to live there for 3 days. But then finally that blizzard moved off and we had clear skies. But then we had to do an avalanche risk check. So our guides ended up getting kitted up, and as you can see, and they all had to move off. It was just that we just sent the three of the guides to go and check, and they tested the snow to make sure that if we did start moving up the mountain, that we weren't going to be at risk of being in an avalanche. So we had to wait for them to do that. And then the following day, we finally got permission to move up to the next stage. So day 7 was a very difficult day. It was an extremely technical day. This was also after everyone had been stuck having to sit, not knowing when they're going to move for 3 days, 3-4 days. But this day, going up the head wall was a over 45-degree angle. And in mountaineering, when you have 45-degree angle, you have to be roped into the mountain. That means we have anchors that we screw into the mountain, and the rope is attached to you. You can see this. These are 2 pictures of myself, and you can see the harness, and the rope goes through the harness. And so if you do fall, at least you're attached. You're anchored into the mountain. And we also had ascenders, which is a tool that mountaineers use that it clamps onto the rope, it slides up, and then you hold it in your hand, and then you could use it. It locks as it slides up, it locks, and you can help to boost yourself up, if that makes sense. So it was a lot of technical use, and because you're anchored into the mountain, you have to undo your carabiner and reattach it every time you come to an anchor. Undo it from one side of the rope and attach it onto the other side of the anchor and carry on. And most of the people on the expedition were not mountaineers. They didn't have a ton of experience in mountaineering. So this was a very stressful day, moving low camp to high camp. So these are some of the pictures. And we also had our crampons on that we had to put on. But in this picture here, so my rope team, of course, is right in front of me. I was right behind our team leader. But you can see another rope team of 5 people right in front of us. And then if you look up at the mountain, you'll see there's a couple of dots, and those are other rope teams that have made it up. And there's one longer line, and that's actually 2 rope teams that are right up against each other. And problem that happened there is one team is going slow and the other team is going fast, but they're stuck now having to go the pace of the slower team, which is a huge stressor for people on these expeditions. So here's another picture of the head wall, and you just see some of the teams moving up, just starting to make it up. And you can see up at the top right corner, kind of where you start to get into that exposed rock, there's another rope team just kind of sitting up there as well. So that whole part was extremely technical. It was, a lot of people were struggling with those technical issues that they hadn't mastered yet. We ended up getting to this lunch ledge. That's this picture here. And that was the spot where we were actually able to take a quick break, throw another granola bar into your mouth, just to give yourself some food and energy. And in mountaineering, there's a term called crux points, crux, C-R-U-X, crux points. Crux points, it's a term in mountaineering that can be geographical, it could be weather related, physical, or mental. And it's where you think that you may not be able to continue on. And sometimes in crux points, if it's a geographical crux point, it could be that part of the mountain has fallen away due to a avalanche or rock slide or what have you. And now it's impossible with your own technical capability to get past that point. It could be weather-wise, where we had that blizzard coming. That would be a weather crux point where you have to turn back. But we also have physical crux points where you're injured, you have to turn back, or a mental crux point where you're physically exhausted. And this is where that self-talk starts to come into play, where you'll start saying, well, you know, this is really hard. I made it up here. This is a beautiful view. I got to see this view. Maybe I should just turn back. And actually what ended up happening at this lunch ledge, and you'll find that a lot of crux points happen when people take a break. But what happened at this lunch ledge is the South Korean team that was ahead of us, they ended up turning back. We had a number of different teams from different countries that were trying to summit this mountain at the same time as us. And the South Korean team turned back at this. And for some reason, the lunch ledge posed a crux point for them. So this is just a photo of the rope team ahead of me, and just shows some of their equipment and how they're roped in to the mountain. They're also roped into each other. So you're roped in as a rope team, but then you also have the rope where you're roped into the mountain. I believe it's the purple rope that's going through. That's the one that's actually attaching them to the mountain. And at every anchor, you have to unhook yourself and then rehook yourself onto the other side. And I'll just quickly mention, I'll go back once more. On one of these teams in the slide, in the picture on the right-hand side, one of these teams, their team dynamic really broke down. And one of the individuals, their main goal, her main goal for being on that expedition was to have this amazing experience with other people on this mountain and to have this great social interaction. Yes, to get to the top of the mountain, but that wasn't her main goal. It was to have this great experience with them. And unfortunately, because her team, their dynamics just didn't mesh as well as some of the other teams. She just didn't feel like she had that social interaction, and that was one of her main goals. And actually later on the expedition, that individual, she didn't end up going for the summit. She turned back when a group did turn back, and I'll explain that moment in a little bit. But her reason for turning back, her crux point, was social relations with others that she didn't have. She didn't feel that connection, and her reason for being there, her commitment to getting that goal. So this is just the views of going up that mountain, and I just wanted to include them because I always kept trying to stop myself and pinch myself to take a moment and look at this, because out there, no human has been out there. And here you are stuck on the side of a mountain trying to get to the top. You just always want to take a moment to reflect on where you are and how amazing that experience is. Yes, it's hard. And yes, it was a very grueling day and moment, but I just really wanted to take a couple of moments to just take that in and look at what we were going through. Yeah, it was just, and actually at this point here, I remember thinking all I wanted was a pink grapefruit because we couldn't have fruit. And whenever I see this image, I always think pink grapefruit because that's what I really craved at that moment. So this is the high camp. We finally made it to the top of that day. That was the most technical and physically demanding day. And at high camp, I got up to the top and team dynamics seemed to be just disintegrating with some of the people. Everyone was completely exhausted. It was our longest day. It was our most physically challenging day, as well as our most technically demanding day. So people were mentally exhausted, physically exhausted, and some of those teams were disintegrating. When I got into this high camp, this is 11 o'clock at night. Of course, it's Antarctica, and at that time of the year, it's 24-hour sunlight. The high altitude was impacting people. People were getting annoyed with each other. When I got up there, I noticed people weren't taking off their crampons. That's the spikes on their boots that help them bite into the ice. They weren't taking off their crampons, which is something you're supposed to do when you get into camp. People were working and leaving their harnesses on. They didn't get their warm jackets on. Like you go down to base layers when you're moving on expeditions, on polar expeditions, because you don't want to sweat. And you're exerting enough energy that your body keeps you warm and you're just in basically thermal underwear. And so when you stop moving, you're supposed to put on your big parkas. People weren't doing that. And one individual was getting hypothermia when I came over the ledge. They're just sitting on their backpack and just started to shiver. And their team didn't even notice that this person hadn't put on their parka. And so I called a team from another, I think it's an American team that had their tent set up that weren't part of our expedition. And they saw that this individual was getting hypothermia. So they grabbed that individual and got them into their tent with some sleeping bags just to warm them up. But it's just amazing how quickly high functioning teams can just start to fall apart when everyone gets that physical and mental exhaustion, and that team dynamic starts to just disintegrate. We were slow at setting our tents. People weren't looking out for each other. People were getting hypothermia. It was all falling apart. But we got ourselves sorted. Everyone got into their tents. Everyone got food into them. Everyone got a good sleep. And we were now there for a couple of days. This is a view of from high camp. And I took this picture and it's looking down to low camp. You can see low camp down at the bottom left-hand side of that picture there. You could kind of see two orange dots. That's low camp way down there, which is about 3,000 feet down. So the next, after a couple of days, day 9, we then went for high camp, to the summit, from high camp to the summit. We had a crux point on this day, even before we left. You could see high camp is right at the back there, at the ledge of the mountain. That's where our tents are. And on this day, we had an individual that could not carry on. That individual is one of our military participants. He had injured his back in a vehicle explosion in Afghanistan, and it had taken him a couple of years to be able to walk again. And that climb up the head wall had aggravated his spine, and so he couldn't leave high camp to go for the summit with us. So that was a physical crux point that there's no negotiation around that one. There's no way that he would be able to get around that. Sometimes crux points, you can't negotiate with them. And so he stayed back. For this day, we were looking forward to a 3,600 foot elevation gain over 7 kilometers. It'd be 14 kilometers return because we're going to the summit and then we had to get back because our tent and everything was at high camp. This was a very high altitude. The pace was extremely slow at this point. So this is just some of our route. That route right there that I just drew in pink took 3 hours, just that short distance. It seemed short. Our pace was that slow. And this was another crux point. So where that red circle, so the peak of the mountain is in this photo. It's just a little bit over the ridge at the top there. And that red circle was another lunch ledge. It was another waiting ledge. But before you get to that red circle, there was a ice shelf that was a 40-degree angle. And you could see this green arrow points the route that we had to take. And right where there's a couple little specks, that's another rope team. They're on the ice shelf, and it wasn't snow, it was just a sheet of ice. And we just had our crampons that kept us on the mountain. And that's a real technical skill, and it's not a difficult skill to master, just believing in your equipment. But if you're not used to wearing crampons on ice and at a 40-degree angle, and knowing that there's crevasses, you can even see some crevasses in this photo where there's the cracks in the ice. It was terrifying for some people. And so that was a crux point for them. So at that point, they just decided that they were not going to carry on. So some people in a rope team that was just in front of us decided that they were done, they're going to turn back. And so right on this ice shelf, we had to switch rope teams around because we couldn't just send one person back. You have to go back as a group. So there's two people that decided that they couldn't go on anymore. They'd had enough, but we had to send a team of 5. And one of the guides had to go. And we also were informed that if we decide to carry on, we cannot turn back, because then we're really risking our ability to get to the summit, because we all needed a guide for each rope team. So that was also another thing that played into people's heads, was this is their last chance to turn back, if they're going to turn back. And this is where we get into that self-talk and those perceptions again, because they're telling themselves, well, if I don't turn back now, I can't turn back later. And I'm terrified now, and I'm tired now. Maybe I should turn back now. But if they just trusted their equipment and their ability to get up that 40-degree angle to that lunch ledge, they would have totally been able to make it to the summit. This part of the climb was a lot less technical than the previous day when we went up that head wall. But people are exhausted. The altitude is playing at them. And also just they weren't trusting their equipment. They didn't have that technical mastery of the tools that they were using. So that's one of the things that really impacts expedition, getting to your expedition goals. So this is the lunch ledge looking down at where the team turned around, and the red circle is where the team of 5 people turned around. And one of the people that turned around in that group was the one that had the disintegrating social relations with the other people from the head wall. So the reasons people turned here was the technical difficulty or technical mastery and not trusting their crampons. The cold was another reason. One person felt that they couldn't handle the cold anymore, and it was getting significantly colder as we're going up the mountain. And then the other one was the social relations with others. And this is the speed that we were walking. This is just a little video to give you an idea. I took this video to show you how very slow, which is infuriating to do over 10 hours, 11 hours, 12 hours of the day. And what people were saying they were finding very stressful was that no control over the pace. And when I spoke to people to ask them, like, well, how are you dealing with that stress? And they confided in me that, well, actually, they weren't keeping a tight line. Like you could see here, Andy's behind me, and he's waiting to take a step until I take a step, and he's not taking a step until I do. And what people were doing, though, is they would take 3 quick steps, and then the line would go slack, and then they'd wait until the line tightened again, and then they'd take 3 quick steps, and then stop and wait. And so even though they're moving at the same pace technically, because they're not getting anywhere faster, because they have to wait until the line goes tight again. But in their mind, they felt that they were in control of their pace, because they were doing 3 quick steps and then being slow, 3 quick steps and then being slow. Meanwhile, it's the exact same pace, but it's fake control, and it helped them feel like they were in control of the situation. It helped them with their stress. So these are some photos of the summit. The issue with the summit was we didn't have any fixed ropes, and it was ice mixed with rocks. So we have our crampons on with this. And so we're walking on these big ice chunks with the spikes on our boots, and we weren't fixed into the mountain. It was a double exposure, which means as you get up onto the ridge, you could see all the way down on both sides, the 16,000 feet down on both sides. It was extremely windy, and it was minus 65 Celsius up here. And so these are, and what I really struggled with was this picture at the top here. I thought that was the summit, but it was actually a fake summit. You get to the top and I thought, yes, we've done it. We could turn around and get down now. But when I got over it, the next view was the one at the bottom where you're just on the ridge and you have to go another 50 feet because the actual summit was further over. So we had to walk across this double exposure. But we got to the summit. This is the picture of the summit. That's me on the left. And that's the one picture on the right there. That's one picture I was able to get before my phone died from the cold. But we were up there very quick, very fast because it was -65. It was windy and it's extremely dangerous on a summit. So we didn't want to stick around for too long. So I'll just go back to this one. So after the summit, we had to come down, and it's a spot called the Summit Col, which is a spot right before the summit. That's kind of a staging area where you can adjust your equipment for your summit attempt. So once we had hit the summit, our team came back to the Summit Col, and we had to wait because there's one other rope team behind us, and they were the last ones. And we wanted to make sure that they made it to the summit and got back off before we start going down to high camp, because if we left and they had a problem, there'd be no one there to help them. So we had to sit in the Summit Col, which was just a little bit like before the summit, and it was -65. And my feet had been freezing up to this point, and my feet had been really painful. And I remember standing at the Summit Col, because now we're not moving, we're just waiting for this last team to come and join us. And at one point, I stopped feeling my feet, and I realized, well, that's kind of it, because if you don't feel your feet, that's when you're starting to get gangrene setting in. And we then had to then walk down to high camp, which still took another 5 hours to get down from our summit. So that whole 5-hour walk back, I was sitting there thinking, well, if I have gangrene, I'm probably going to have to lose my toes. But I was saying, well, it's okay though, because like I've done the North Pole, I've done Antarctica, my toes don't owe me anything. I'll still have my feet, I'll still be able to be fine. We finally got to the high camp, and I got into my tent, and I quickly took my boots off and my socks off and checked my feet, and they were starting to turn gray. But I warmed them up, and I still have my toes, but I did lose my toenails, which did grow back. But anyways, it was standing around is not something you want to do at the top of a mountain, because it gets very dangerous for your feet. So then on the 10th day, we moved down, back down, all the way down to base camp. So what took us 10 days to get up to, we were able to get all the way down to base camp in one day, just because gravity was helping us. But there's still challenges, even though gravity was helping us. Psychologically, it's really difficult to look down a mountain and walk down. And we basically walked down like looking down the mountain, face first, and we just kind of scaled our way down. The team dynamics had depleted for one of the rope teams. We had the individual with the back injury. We had to bring him down on a spine board. So we had to do all this with the individual on a spine board, a stretcher, and everyone was completely exhausted. But they did it. They got to the bottom, and like it was great elation. And one of the quotes that I had from it, this is one of my favorite ones. So I went through the full spectrum of emotion in 12 days. I smiled, cried, laughed, meditated, starved, suffered, exhilarated, feared, froze, and overheated. I felt sick, inspired, weak, energetic, and at times like a superhero, while at other times like a loser. I made good shots, but I also made mistakes. And this is just us at the bottom of base camp. And so when we're talking about the things that really helped some of the people get there with Antarctica, because everyone had to walk in a line, and they weren't, with North Pole, everyone was able to like walk and ski together in a group. With Antarctica, it was very a siloed expedition. You had to walk in a line, and you're a good 5 to 6 feet from the next person in front and back. And so you spent a good 10 to 12 hours each day sort of in your own mind. And those perceptions and that self-talk really started to impact people on this expedition. But did find through the interviews that I had with people that the things that helped them get through those crux points and being able to reach their goals was that continued effort despite the adverse conditions. And that was impacted by their commitment to the team, positively embracing the challenge, not seeing these threats, and construing. A number of the participants were over 50. And they thought that that was a weakness, but then they found as they went along that that was actually a strength because it gave them that experience. Again, we go back to the dandelion, all the life experiences that you could bring to this challenge, and what can you draw upon in your own personal toolbox. A lot of the people who got through and got to the top of the mountain, if I asked them what helped them get to the top of the mountain, they'd say, well, I have this, I can do this. Like it's an I statement. And a lot of the people who didn't make it to the top, their statements were more of the other people, more of external. And I saw that when I used to work in PTSD research, and I'd be talking to people that were struggling with depression and anxiety. And a lot of times I'd ask them, well, what kind of resources do you have? And they'd say, well, I have my psychologist, I have some medication, I have, my therapist. It was all external people. And then some of the people who had PTSD but were thriving, I'd ask them, how are they dealing with? And again, it was the I have this capability to do this. And so these experiences and that self-talk and those perceptions, really starting to understand what can you bring to yourself to help you get through these? What are your personal strengths and endurance? So it all breaks down to, in physical and psychological. We do know that these are the things on the graph here, on the table here. These are the things that help people get through and be resilient and thrive. That strength, endurance, nutrition, and sleep hygiene are extremely important for physical thriving. And psychologically, it's how do you perceive the challenge? Is it something that you could thrive from? Is it something that you can grow? Or is it a threat? Do you constantly see challenges as a threat? Then you're rewiring your brain and strengthening those negative connections. How do you see the control of the situation? So a lot of people felt that they were out of control in the expedition, but once they started to come up with ways to have even fake control with that pace, right? They weren't changing the pace. They're still going at the same pace, but they were taking 3 steps at their own pace and then stopping and waiting and then taking 3 steps again. That was enough. It was fake, but it was enough for them to perceive that they had control, and it allowed them to have that self-talk with themselves that they're in control, and it helped them get through that. The confidence, that comes back to confidence in your equipment. If we're taking an example from the Antarctic expedition, there was the lack of confidence in technical mastery of certain equipment, and that did not allow them to get through. Confidence can also come from experiencing different adverse events and knowing that you're strong enough, knowing that you have the tool set to get through it. Again, that dandelion. And then commitment, your why. Why do you want to get to the top of the mountain? What's your reason for it? For that one participant, their why was they just wanted connection with people. And unfortunately, that rope team wasn't connecting. And so they didn't make it to the top because that was the only reason they wanted to get up there. Their why was gone. Their reason for trying to get to that goal was gone. And that makes it pretty impossible to get past those crux points. So I hope that this was helpful and at the very least interesting. I'm happy for any questions that anyone might have.
Thank you so much, Sarah. That was such an amazing amount of information that you shared and the research that you had. I kept looking at those pictures of you thinking, she is so adventurous and courageous being up there. But I'm sure it also was, I would expect, a pretty incredible experience for you.
Yeah, well, and honestly, like I'm terrified of heights. And I really don't like climbing mountains, but I faked it until I made it. So
and sometimes we have to do that, and
yeah.
We're surprised at what we can actually do. So there are a few questions for you.
Sure.
One of the comments here, Dr. Dentry, your summary here is my entire life in cancer treatment right now. Thank you so much.
Oh, Thank you.
Just really appreciating what you've been sharing. Then we also had, I guess it's a question here. Do you think that the fact that it was always light contributed to the positive attitude of the polar participants?
Oh, that's a good question. You know, it was also always light in Antarctica as well. Some people did struggle with the light, especially there were a number of people that had PTSD on the expedition, and they had a lot of trouble with sleeping just normally. And actually, one of the participants who had severe PTSD and could never get a good night's sleep back home on the North Pole expedition, that individual actually built himself a snow tunnel and slept in a snow tunnel instead of a tent. And he said he had the best sleep of like the last 10 years since he had his traumatic incident. So like there's typically having that bright light, it impacts your sleep, and you really need to have good sleep in order to deal with stress. It's one of the most important things your body needs in order to be able to handle stressors and such. And even if you're not being stressed by something, if you don't get good sleep, you will become stressed. And most people do feel that. You don't need to know the science behind it. But it was interesting in both cases with that 24-hour sunlight. Yeah, I think everyone kind of approached it differently. Some people had amazing sleep and some people struggled.
It's really very, very fascinating. But as you say, sleep is huge and can make it such a difference in how we actually make it through the next day and enjoy the day. There is another comment, and it's about the similarities between these expeditions and the cancer journey, like the waiting you go through and the unknown playing with your mind. Do you have any thoughts on that and the research that you did?
Yeah, the unknowns, you know, in all the expeditions and working with PTSD people as well, it's unknowns that cause a lot of stress for people, and it makes it very difficult to handle those. And you know, the best thing that you can do when you're dealing with the number of unknowns is try to educate yourself as much as possible, and going and getting that as much literature and as much resources as you can really helps you, one, start answering your questions and start feeling like you're starting to understand what you might be going through and what's happening to you. But two, it also makes you feel like you're in control, because it gives you something that you can control. Control doesn't have to be a huge thing. It could be, you know, as simple as going to a resource center and choosing to get information for yourself. And then you have some control over what you know about what you may be going through.
So true. And I was just thinking, Dr. Stobart earlier had commented on the importance of education and helping to make good decisions and understanding first to make a good decision. So that's that's also very helpful. And there was one other thing here, just something that I was picking up on was the skydiving. And the two different people and that perception piece, I found that very interesting as well. So one person can't wait to touch the ground. It's the worst thing they've ever had happen. And then the other person wants to sign up for more.
Yes. Well, and there's a number of things that contribute to that. I mean, people's previous life experiences, their family dynamics, how if they've experienced things before, if they had one of the more difficult things is if you've had a traumatic, challenging experience and you weren't in control, you never gained that sense of control, you never gained that feeling of, I can grow from this, then that's going to be really debilitating in future experiences. So one of the best things a person could try to do is have those moments where they have a threat, but they can safely navigate it and then learn that they have the ability to do it. Where it gets difficult is if you haven't had a lot of major threats and then all of a sudden you have a huge threat and you don't know how to navigate it. Or if you've had so many and you just never had the chance or the resources to really help you get through and to have a positive experience from it. So it's not, I know I made it very simple with a skydive and thinking, you know, it's just, you just choose which one you want to have. It's not that simple. There's so many things that go into it, personality traits, your genetics, what you were born with, but also your environment that you grew up in. But then the positive note on that is you can actually start training your brain to rewire and training yourself to start seeing things as something to grow from.
So important. And as you say, it's really also, you talked about the toolkit and resources. And the more that you can work through some of these difficult things that happen to us all in life,
Yes.
and especially when you're dealing with treatment and cancer and tests and waiting, is just continuing to remember the times that you had something difficult, what you did, and that you got through it.
Exactly.
You got
You
through
get
it.
through it, and then also the care team and the people that you have around you as well.
Yes, yes. So there was one other thing that I thought was interesting. When we started the evening, we had Miss Alan Sutherland sharing about, as part of, I guess, the opening prayer, he was talking about the importance of hope, that when there is darkness and difficult things in life, that's something that can keep us going. And he talked about the importance about keeping moving forward.
Yeah.
And I was thinking about that, and you had talked about different parts of that expedition when things were getting increasingly difficult. People are tired. Do you have any other thoughts around that from some of the research or things you'd like to emphasize to people to remember?
Yeah, well, and that's the thing. It's like everyone's light, everyone's hope is different, right? Everyone has a different reason for that hope. And in the expedition, I was saying it was the goal of getting to the top of the mountain. For that example, getting to the top of the mountain, that was what everyone set out to do. And the reason for doing it was different for every individual. And when we saw people not able to attain the reason for doing it or losing that connection, the reason for them being on the mountain, that's when they gave up and turned back. But it's always trying to find, we had some people who couldn't make it, but they'd find another reason to keep on going. It's just trying to keep reevaluating, and that self-talk is so important. And you could start, when you start working on self-talk and seeing what type of perception you are bringing to the situation, when you start working on that, you could start identifying, okay, wait, I'm doing a self-talk, I'm doing a perception that's not going to help me get to my goal. It's not going to help me have that hope. It's going to actually take all that away. You just kind of have to try to recalibrate and find the next thing that you would hold on to get you to the top. So
Thank you. Thank you so much. A lot of interesting information, but also some very, very helpful learnings and ways of coping that I think really do apply to what happens when someone is diagnosed and then begins treatment and into a journey where there's unknown. There's a plan, but there's a lot of unknown in how things unfold working through that. So really, really appreciate your time. I know that you are currently away, I believe, on vacation, so even more so. You're amazing. There's one more question here. Dr. Dentry, you chose this challenging adventure. What would you say to those who didn't choose their cancer adventure?
yeah, that's true. And that's the thing. A lot of people ask, like, because when I did personality tests on everyone, on the participants, they were all a similar personality type. They all signed up to do those expeditions, even the ones with amputations, because they felt that they could possibly get to the top of the mountain. It's a very specific group that decided to do that, and that is difficult when you have individuals that don't choose that. But the flip side of it is all the military personnel that were on that expedition had been either blown up in explosions in Afghanistan. They all had injuries that they didn't see coming, they didn't expect to have, and that they were working through. They used that expedition to help them process that, to help them process their emotions, help them process their transition from what they were before, which they all saw as a warrior, a person that's there to help others and rescue others and provide. And then they all were viewing themselves as broken. And they used that expedition to help renegotiate their identity, to show themselves that they are not broken and they can do these amazing things still. They just had to find that way to it, right? And it's just that journey of finding your own personal resiliency and what you need and what you can bring, your personal tool set, what you personally can do to help you get through that process. So even though they chose to be on the mountain or they chose to go to the North Pole, they had all had these huge injuries that they had sustained during their military career, and they thought that they were done. They thought that they were broken, and they were really struggling at the moment that they signed up for those expeditions. And they used it as part of their journey, a very literal journey for them. But yeah. So I would recommend perhaps trying to find something that you could use as your journey. And we'd always say things like, leave it on the mountain, leave the negative on the mountain. Like, this is your moment to conquer it and leave the negative, and you've conquered the injury that you might have sustained. And so having that journey, finding something that you can take as a journey, it doesn't have to be as extreme as a mountain, so.
Something that can be part of beginning to heal.
Exactly. Yeah. Well, it's the process, and it's learning about yourself, and that self-reflection, looking at how you're perceiving things in the self-talk, as I've mentioned a number of times, but it's also reminding yourself that you're still able to do amazing, wonderful things. You just might have to recalibrate sometimes what your perception of the amazing, wonderful thing might be. It's finding your new normal.
Yes, yes, and that comes up quite a bit as well. We hear that quite often after someone has had cancer and going through treatment and then finishes treatment. So thank you very, very much. We are so grateful that we were able to hear about your research, and you had so many amazing photos that captured that incredible spirit and resiliency. And I think there have been some really concrete tools and things to think about that my hope is will help many of the people that were listening tonight. So really, really grateful to you.
Well, thank you very much for letting me come and share the stories of the expeditions. And I do hope that it has been helpful.
Very much so. So enjoy the rest of your time.
Thank you.
Okay, well, our evening is coming to a close. It's hard to believe. There are just a couple, I guess, of things to remember before we close for the evening. And one of those is that just reminding everybody that we start tomorrow morning at 8:30. I think people can start logging in, 5 or 10 minutes ahead of time so that they can join. I'm just looking through. We finished up with all of that. Just another reminder about looking at the virtual booths. So if you want to have a look at any of those information and resource booths that I was mentioning earlier in the evening, you're welcome to still do that. They don't shut down. They'll continue throughout the evening. So please take some time. And when education and information, we've heard a number of times how important that is, and there are a number of really good information pieces that you'll be able to learn a bit more about, and education and support sessions and programs that we have. So I encourage you to do that. Something else that's really important is, even if you are able to attend just a few sessions tomorrow, maybe you can't join bright and early, maybe you need some extra time to sleep a bit longer, that's okay. You can join for any sessions that you want to. You don't have to be registered for each one. You're registered for the full day. So you can pop in and out of whatever might, fit for you throughout the day with whatever you have going on. And the other thing I was going to say is, if you know anyone, friends or other people you've met, please, if you think that this would be helpful to them and that you're finding and looking at the topics tomorrow and the speakers, that they would be of interest to someone, they can still register. They can still join. So I really want to make sure that that's clear, and we would be very happy if we could have even more people joining tomorrow, because there, as you know, probably looking at everything that's going on, there's a lot of work that goes into putting a program together, and the speakers volunteering their time. So we want to make sure that people get to learn and grow and ask questions. That's what this is all about. So I would like to thank all of you for joining us tonight. Looking forward to seeing you bright and early if you can make it for 8:30. We will be here for sure. And I think that you're going to find that there'll be a lot of very interesting topics and a lot of excellent speakers tomorrow. So we will see you all at some point tomorrow. Take care.